Asperger syndrome in children. An overview. Asperger syndrome, named after the Austrian pediatrician Hans Asperger, is a form of autism spectrum disorder. This video aims to give parents an understanding of what constitutes Asperger syndrome and to help them recognize possible signs in their children. Asperger syndrome is a neurodevelopmental disorder that is part of the autism spectrum. Compared to other forms of autism, Asperger's syndrome is characterized by normal to above-average intelligence. Children with Asperger syndrome often have difficulties in social interactions and show repetitive patterns of behavior. It is important to emphasize that every child is unique and symptoms can vary in severity. Children with Asperger syndrome often show difficulties in establishing and maintaining social relationships. They may have difficulty making eye contact, understanding nonverbal signals, and behaving appropriately in social situations. This can lead to them appearing withdrawn or socially awkward. Children with Asperger syndrome often develop highly focused interests that can be unusual in their intensity. They tend to stick to fixed routines and can cling strongly to certain activities. Repetitive behavior, such as repeating movements or sticking to certain rituals, is also common. Verbal communication can be a challenge. Some children with Asperger syndrome have difficulty expressing their thoughts and feelings appropriately. The language can come across as formal or strange, and misunderstandings can arise in communication. Some children with Asperger syndrome may have difficulties with fine and gross motor skills. This can manifest itself in clumsy movements or uncoordinated motor skills. Early detection of Asperger syndrome is crucial in order to provide appropriate support. Parents should look out for early signs, such as, for example, a lack of social interaction, unusual interests, or difficulties in language development. An experienced pediatrician or child psychologist can help with the diagnosis by observing specific developmental characteristics and behaviors. Once a diagnosis has been made, early and targeted intervention is crucial. Individually adapted therapeutic approaches, including behavioral therapy and social skills training, can improve children's quality of life. Close cooperation between parents, teachers, and therapists is essential to create a supportive environment. Asperger syndrome is a complex developmental disorder that can manifest itself in various areas of life. Comprehensive knowledge of the early signs and prompt diagnosis can pave the way for parents to take targeted support measures. With a multidisciplinary approach, children with Asperger's syndrome can develop their abilities and achieve positive development. It is important to emphasize that every child is unique, and a respectful and accepting attitude towards individual needs and strengths is of utmost importance.